Okay, so there we go. So again, welcome everyone to the Age-Friendly Community Strategy Workshop, and I'm going to turn it over to Mayor West to say some welcoming remarks.
Well, thank you very much, Jody, and good evening and welcome to today's workshop, everybody. This is the city's age-friendly community strategy that we're working on tonight, and we thank you very much for being a part of that. I would very much again like to thank you for your discussion that we're going to be having tonight and the time that you've taken to be with us. Your involvement here and your input will help to ensure that the age-friendly community strategy results in a meaningful recommendation that reflects the voice and the spirit of our community. Tonight, we'll be sharing an update of what we've heard and learned from background research and consultation activities. Jody Ball of J Consulting Group will be leading today's session, and Jody will be presenting the draft vision and principles for the strategy, and we're looking for your feedback on the direction of the city's age-friendly community strategy. Jody and her facilitators will lead the group through some small group discussions on the preliminary strategies for each of the 8 World Health Organization age-friendly domains, and we look forward to your comments and recommendations. We want to ensure that everyone's voice is heard in this age-friendly community strategy. But before we begin, I'd like to introduce Deputy Mayor and Local and Regional Councillor Godwin Chan, who's with us today. And I'd like to, in a minute, invite him to say also a few words. Unfortunately, I'm not going to be able to be with you tonight as I have another event that I need to be at shortly after this, but I do wish everyone best of luck, and thank you so much again for participating. So at this point, I'll put it over to Deputy Mayor Godwin Chan.
Thank you. Thank you very much, Mr. Mayor West. As Deputy Mayor and actually the mover of having the City of Richmond to work on the age-friendly community strategy for, I'd like to also extend a warm welcome to everyone who's actually participating tonight, because not only that you could participate tonight, we look forward to hearing your input, because the strategy in the end has to be reflective what the community tells us, and this is truly that what people need. In addition to later this week, there will be an online survey that accessible at richmondhill.ca age-free. And please fill out any information or input that in addition to what I might have said tonight, and also your friends, your neighbors. And for example, if you're any particular group, talk to your group members and let them know that you actually are participating, and welcome them to go to online to some comments on that online survey until May 8th. So I want to say that you are actually very important. You have much to do with Jody. I want to extend my deep appreciation, everyone's input. And again, because of you and because of input, our age-friendly community at the end would be for everybody's input. But like Mr. Mayor, I also could not to stay for the whole session, but I wish everyone a very productive and engaging session. So thanks again, and I pass on to Jody, who has led us over what this is all about and what tonight's workshop will be working on. Thank you again.
Thank you so much, Mayor West and Deputy Mayor Chan. And I'll just echo your gratitude for everyone for joining. So thank you for taking some time this evening to join us. As I mentioned, my name's Jody. I am the director of J Consulting Group. And we've been working with residents and community stakeholders, city staff, and members of council, as well as the city's age-friendly community council in developing the city's age-friendly community strategy. So I'm happy to be here this evening. Looking forward to sharing with you some of our learnings to date, some of what we've been hearing so far in our process, and sharing with you some of our initial ideas in moving forward. So as we get started, I will just introduce some of our team members that you'll meet a little later on when we do our breakout rooms. So maybe just give a wave. We have Karen Sabzali, Cassandra Vink, Ashley Lewis, Vivienne Cottle, and Patricia. So thank you. And Patricia is our graphic facilitator. So Patricia is going to be listening in and visually recording the themes from the discussion today. So following our discussions, I mentioned we'll have some breakout groups. Following those, Patricia will share with us some of what she's interpreting from our conversation and the story of the city's age-friendly community strategy. So our evening, as I mentioned, I will give a presentation of what we are hearing and what we've learned so far in our process. And then we'll spend some time reviewing our initial ideas, some preliminary strategies for the age-friendly community strategy, and have a conversation cafe with you. So that's where we'll go to our breakout rooms. And then we'll do a quick wrap up. So we've got lots to do over our 90 minutes together. First, a little bit on the process. So as you know, the City of Richmond Hill is taking steps towards becoming an age-friendly community, one which is providing opportunities for people of all ages to participate in activities that keep everyone healthy and included in community life. To achieve the goal of becoming an age-friendly community, the city is embarking on the process of developing an age-friendly community strategy as part of Council's strategic priority to create a strong sense of belonging. The strategy will set out a long-term vision, collective goals, and inclusive strategies to improve older adults' ability to age at home, live safely, and enjoy their community. So a little bit on our overall process. We began back in November preparing a research and engagement plan and initiating some research activities. So that was looking at existing policies and plans and reports, looking at existing data, and of course our engagement, which was largely in phase 3, so over the last few months. And that's where we launched the project on the city's website. We held several focus group style events with city staff, with community organizations, as well as residents, and we did a community survey and some interviews with staff and members of council. We also at that time held our first meeting with the city's age-friendly community council. And that's a group that was formed earlier this year and is aimed at not only informing and guiding our process in developing an age-friendly community strategy, but staying together and continuing their work together towards implementing the various recommendations that are put forward within that strategy. So they have a very important role in not just developing the strategy along with us, but they'll be there for the implementation of some of the ideas and strategies that go into that planning document. So we're now in phase 4. That's our final phase, where we are doing our second round of engagement. So that's part of what this evening's all about. We have an in-person session that's the same as the same content as this evening, but it'll be in person tomorrow morning. And we'll have an online survey as well that Deputy Mayor Chan mentioned, and I'll mention a bit more towards the end to make sure everybody's got the link for that. And once we're done the workshops and the survey, that's when we'll really pull together the full strategy. We'll also be having some further engagement with city staff around some of the directions that we put forward. So we're hoping to have the draft strategy completed before the summer, and then we'll present the final strategy to council in September. What's next? Our framework. Yeah, I'll just take a minute on this one as well. So our framework for developing the City of Richmond Hill's age-friendly community strategy is really built on the World Health Organization's Age-Friendly Cities framework. And that framework proposes 8 interconnected domains that help identify and address barriers to well-being and participation of older people. So what it includes in those 8 domains, the first is outdoor spaces and buildings. So that's thinking about our parks, our green spaces, our trails, and also our public buildings. So things like our municipal office, our community centers, our libraries, The second domain is transportation, and that includes public transportation, as well as thinking about things like our sidewalks and walkways, traffic lights, and signage. And then we've got housing. We want a full range of housing, so thinking about different types of housing, thinking about affordable options, accessible options, and supportive options. The fourth domain is respect and social inclusion. And so that includes people's sense of feeling respected and included in the community. The fourth one is community support and health services. So that's thinking about our mental and physical health programs, access to a doctor, access to dental care, and access to mental health services. Then we've got civic participation and employment. So that includes our ability to work, volunteer, and be engaged in community life. We've also got communication and information. So that's our access to information about events, about services, programs, and making sure that those formats are appropriate and accessible for older adults and people with disabilities. And the last one is social participation. So that includes our level of involvement and participation in recreation activities, fitness activities, and culture activities. So that's a very broad framework for our planning. And as we go through the presentation and as we share some of our preliminary ideas and strategies with you, you'll see things grouped within these 8 domains. So there's lots to think about when we think about age-friendly planning and becoming a more age-friendly community. Okay, so what we are hearing and learning so far, so I'll go through a couple slides here. The first is on policy framework. And so through our review of policies, we found lots of support for age-friendly planning from all levels of government. So each level of government provides a policy context to support creating positive physical and social environments that promote healthy aging across communities. And I'll just point to a couple. One is the Age-Friendly Communities in Canada Implementation Guide. There's also Creating a More Inclusive Ontario, the Age-Friendly Community Planning Guide, which the province updated a couple years ago. We've also got the York Region Senior Strategy, which is currently being updated. And then if we look at local policy too, there's a number of really a strong policy context for age-friendly planning within the city of Richmond Hill, including a direction within Council's strategic priorities, as I mentioned, where age-friendly planning is aligned with the strategic priority of a strong sense of belonging, which identifies the implementation of an age-friendly community initiative to ensure Richmond Hill is inclusive community for all ages. Other local planning initiatives support various aspects of age-friendly planning, including the support of a mix of housing options, including affordable housing, improving transit mobility, creating a multimodal and inclusive transportation network, supporting accessible design, and ensuring diverse and inclusive recreational programming for older adults and seniors. So lots for us to build on when we're developing our strategies for the age-friendly community strategy. So a little bit on the data now. We did look at a number of demographic pieces of data, as well as other household indicators, health indicators, housing need, and income. I'm just going to highlight a few here. The first is population by age. So seniors, and when we talk about seniors, we're talking about people 65 years of age and over. And that age group comprised about 17% of Richmond Hill's population in 2021, which is an increase from about 14.6% in 2016. So like many communities across Ontario, across Canada, indeed, there is an aging of the population in Richmond Hill. Just to compare it, it is a little bit younger than the provincial population, a little bit slightly older than York Region's senior population or population. I also just want to highlight, if we look at adults 55 plus, this group comprised nearly 32% of the total population in 2021. So almost a third were 55 years of age and older. Okay, so if we look at the projections, this is expected to continue for sure. So Richmond Hill seniors population is anticipated to increase from about 36,000 all the way up to just under 70,000 by 2036. So not quite a doubling, but a pretty significant increase. I'll just highlight a couple other demographic trends. One of the things we found in looking at the data was that 21% of seniors in Richmond Hill do not speak English or French. So a number of them speak other languages, many with Chinese ethnic origins, Persian and Russian. And this is in line with some other communities in York Region, such as Markham. It's a little bit higher when we look at, when we compare to areas such as Vaughan and also Toronto. 29% of seniors are living alone. So that's something that we flag as well. You know, it could be a risk for isolation. There are, however, a number of seniors who are living in family households with and without children. Looking a little bit at income, 32% of households with seniors have incomes below 40,000. Seniors continue to also be the largest group waiting for subsidized housing in York Region. So that's the region's social housing list, which seniors make up about 54% of applicants on the waiting list. So that's significant wait times. And not up on the slide, but I'll just highlight there's a long waiting list also for long-term care housing across the city. One other piece is 19% of senior households were in core housing need. And so what we mean by core housing need means that people are either living in housing that is unaffordable, inadequate, meaning maybe it doesn't have, it's not in good quality, not in good shape, or unsuitable, meaning perhaps it doesn't have the proper numbers of bedrooms. So one of those indicators are met to be in core housing need. Some other trends for us to keep in mind, more seniors are remaining employed beyond the age of 65. Many more seniors relying on the internet to access information. Seniors remaining in their homes longer, and we're seeing more seniors relying on specialized transit services. So now what we are hearing. So this is what we're hearing from, again, as I mentioned, the survey that we did in our first phase of engagement, our interviews, as well as some focus groups that we held back in the winter. And so some of the things we're hearing were around vision. So we asked everyone that participated in one of our consultations to ask us to describe in one word, if they could, what an age-friendly Richmond Hill looks and feels like. And so what you see on the screen are some of the responses that we got back. So people mentioning things like accessible, inclusive, friendly, safe, compassionate. And then we also further shared some of those words, some of the feedback that we got with our age-friendly community council to help us put together a vision for the strategy. We also asked participants to think about values, you know, what's important to us when we're thinking about becoming an age-friendly community. And so these are some of the responses that we got that I wanted to share with you. So respectful, again, inclusive, also equality, openness. Some of the other things we heard, and I'll mention it here because there's a lot more that we heard that I'm able to share in a few slides this evening. And it's not there yet, but by Wednesday, there'll be a full consultation summary report on the city's website. So that'll provide a summary of all the feedback that we heard in our phase 1 engagement process. So if you are looking for more information on Wednesday, that should be up on the website at richmondhill.ca/age-friendly, and we'll put that up for you. But if you are looking for more, that's the spot to go. But some of the overall messages that we heard, people want to see reduced barriers to transportation. So making sure transit is affordable, accessible, and also flexible. improving safety on streets, on trails, and on crosswalks. Continuing efforts to improve accessibility within our city spaces, buildings, and our events. Increasing housing options for seniors, increasing community outreach and engagement with older adults and seniors. Enhancing access to community information, hearing people aren't always sure what programs and services are out there. So helping to improve that access to information. Continuing to expand senior programs. There's a lot of programs, but we still heard some ideas for some other ones people are looking at seeing. And improving health navigation and access to healthcare services. So the city is a little bit limited in its role in health services, but certainly can have a role in helping people be more aware of what services are there and in advocating for services within the city. There's one other piece I want to share with you. In addition to our research and engagement activities that we've been doing over the past few months, in 2020, Council approved conducting an age-friendly needs assessment. And the purpose of that needs assessment was to inform and guide an approach to the age-friendly community strategy. And so that was a survey and some focus groups, and heard from over 800 residents as part of that in-depth needs assessment survey. And so some of the things that were found within that engagement initiative were grouped under social environment, physical environment, and personal well-being. So I'll just share a couple of the pieces of feedback. People said that there was a good variety of activities, and certainly we heard that throughout our engagement as well. People are looking for more engagement. They want more opportunities to be involved, and promotion of older adults in the workforce. Looking at physical environment, people want more rest spaces, and we heard that throughout our engagement as well. So things like benches and parks and walkways. Concern over road and crosswalk safety. Again, that was certainly a key message that we heard in our process. And again, the need for housing options for low-income seniors. With respect to personal well-being, people want their information in different formats. So email, mail, website, social media, newspaper. And we also, again, heard that message as well. And then finally, ensuring access to medical care. So a lot of alignment from that survey that was done a couple years ago with some of our findings. So the last slide here, just to summarize where we're starting to hear that people are keen to go, what the data is telling us. So emerging priorities from the work done to date is ensuring that all of our spaces, buildings, activities, and events are physically accessible. We did hear lots of improvements in this area, but also the need to continue that work and make sure that all of our buildings and spaces and events are physically accessible. Again, removing those barriers to street safety and to accessibility, improving our public transportation system. Again, we did hear about improvements there, but also people looking for further enhancements, especially around things like affordability of transit, things like cross-jurisdictional transit, so people being able to get from places like Richmond Hill to the City of Toronto for medical appointments and so on. So transportation was still a big priority for people, as is housing. So making sure that there is a range of housing options for seniors so that seniors can grow old and age in the City of Richmond Hill and not feel that they have to move out of the community. Also enhancing community outreach and engagement. So we heard that people liked being involved in the age-friendly planning process and want to continue to be involved with different planning initiatives, especially related to older adults and senior services. Ensuring easy access to information on services and programs. So again, I mentioned, not everyone knowing all that's available, all the services, all the programs that are available. So trying to get that information out to people. Also working with our community partners to increase access to healthcare services and continuing to expand city programs for seniors. So some of the things we heard about were having programs in different languages, maybe diversifying some programs into outdoor spaces. Also heard people's desire to keep some of the virtual programs that had been offered. So just looking for continued diversity in the programs that the city is able to provide. So that's the presentation component. I will pause for a moment. I have some more slides to share with you where we want to start to get your thoughts and ideas on some of the initial ideas. So as I mentioned, we've been working on this for a few months. We've done our data research. We've done our first phase of engagement. We've met with our age-friendly community council. And so now is the time that we want to put forward some ideas and get your feedback. So I do have some more slides around some of the strategies, but I will stop for a moment. I'm going to stop the recording and I'll just pause to see if there's any questions so far.